This next question is, I've had an erectile dysfunction issue for the past year. I'm in my 50s and I know this type of thing can happen as I grow older, but I don't understand why this is happening to me. Men experiencing erectile dysfunctions and difficulties with their own ability to reach orgasm, to reach full hardness, and to be able to complete sex the way they would like to definitely changes as men get older. However, I've worked with men in their early 20s who have difficulty with erectile dysfunction, and it can come from many different factors. So you sending in the question, obviously you're in your 50s, so you're getting older, but that's still very young. There are a couple of things, especially at your age, that can be factors. Are you under a lot of stress? Are you able to manage that stress? Are you having a lot of anxiety? And there's nothing quicker that can make it more difficult for you to obtain an erection and to maintain hardness than anxiety and getting in your head. A lot of times that men are worried about pleasing their partners, or they're having to perform, and they get anxious about that. And notice that I use the word perform as if we expect some type of performance, and it's really not a performance. It's about both partners really enjoying the time they have together. So this is one of the areas that a lot of men struggle with. So what you want to do is make sure that there's no medical issues going on and have that ruled out. Make sure everything from a hormone standpoint is positive. And also check to see if it's any type of side effects from a medication that you're taking. And remember, if it is a medication issue, consult with your doctor. Don't stop or discontinue medication at any time. Make sure that you do it at your physician's guidelines and what they suggest that you do. It's very important to do that. And there's a couple of techniques if you're continuing to have ED or erectile dysfunction issues. There is the start and stop technique, and there's the squeeze technique. Both of these are very common techniques that are helpful for couples and for the individuals struggling with erectile dysfunction. A lot of these guidelines of how to use these techniques are online, or you can email me and I'm happy to send you an email with some of the techniques in there and some links to those techniques. The biggest thing is don't be embarrassed. And if your partner begins to say that it's them, that they don't turn you on enough, or you don't find them sexy or appealing, that has nothing to do with it. The other person has nothing to do with the ED that you're experiencing. The biggest thing is to get out of your head, don't worry, bring down the stress, and find a way to communicate if you're in a relationship with someone and you're experiencing this. Be able to talk about it without shame and without fear. Also, if you don't feel comfortable going to your doctor, go to a counselor who's trained in sex therapy, who works with these issues that people battle, so that you can find a safe, non-judgmental place to work on improving this area. And it can be improved, and you can work through this. Thank you.